Good morning, everybody. So do you know what 10 pounds of fat actually looks like? Well, I'm holding 1 pound of fat. So if you could imagine 10 of these, okay, and if you were to hold 10 pounds of fat, it is equivalent to 2 bricks or a large bag of potatoes. So we all want to look good and feel good, right? So clap it up if you're thinking, man, I could stand to lose a few lbs. Or maybe we just want to be more fit, more toned, or we want to eat cleaner, okay? But maybe it's all of the above. But there's something that's said about having a heart, and that is both in a kind and loving way, but also in a healthy way. So as college students, we all are busy, but we need to find the time to treat our bodies good. So section 2, number 7, letter F of the Earth Charter states, adopt lifestyles that emphasize the quality of life and material sufficiency in a finite world. So let's get our hearts pumping with a healthy beat as I move into main point 1. So raise your hand if you know anyone that's ever had a heart attack. Well, obesity is a global epidemic and a major contributor to heart disease. Let us look at 2 risk factors. An article by the American Heart Association journal states that obesity contributes directly to hypertension. Now, I learned that abdominal obesity, which is measured by your waist circumference, is a cardiovascular disease risk marker that is separate from your body mass index. So my mom, Sandra, she had open heart surgery 5 years ago, and she still has hypertension due to being overweight. Now, when I worked at Mount Sinai Cardiac Rehab, I saw many patients that were affected by heart disease. Most of my patients, they had open heart surgery, heart attacks, and or they had stent placements. Now, some of the patients had reoccurring heart attacks, and some unfortunately died because they did not make the necessary changes and keep it up. In 2017, the American College of Cardiology and the American Heart Association published new guidelines for hypertension. So throw in the chat 120/80, okay? This is a normal BP, okay? This was my visual. Now, hypertension is a blood pressure of 130/80 or above. And then you have a stage 2 hypertension, which is 140/90 or above. Now in 2019, research showed that hypertension was a contributing cause to more than 500,000 deaths in the United States. People walk around with hypertension and they don't even realize it because it's a silent killer. Everyone say silent killer. You know, my husband, Kevin, he has high blood pressure and he's very non-compliant with his diet, his medication, and exercise. And he's married to a nurse. Go figure. So according to WebMD, extra pounds raises your cholesterol. So hyperlipidemia, that is having too many fats or lipids in your blood, such as cholesterol and triglycerides. Now, research shows that a diet that's high in lipids and cholesterol raises and increases your risk for heart disease and heart attacks. It's treatable. It lasts a lifetime. Diet, exercise, and medication, they do help. Now, what one type of hyperlipidemia is called hypercholesteremia. Now, I'm genetically exposed to this, and I take 20 milligrams of Zocor at night. I take it every night before I go to bed, and I don't have any side effects. I don't feel any side effects. So the American Heart Association recommends that adults 20 years and older test for cholesterol every 4 to 6 years. Now, research states you have to fast before you take your cholesterol test. And anything that's 200 milligrams per deciliter, that is considered high cholesterol. So I usually schedule my appointment first thing in the morning before I have my coffee or my food. And even with diet and exercise and my medication, my cholesterol is still 210. Now, there's 3 main components that make up your total cholesterol. And that is your low density lipoproteins, your LDL. That's the bad cholesterol. Then you have your high density lipoproteins, HDL. That is your good cholesterol. And then you have triglycerides, which are your sugars. Now, my total cholesterol is 210. However, the LDL, the HDL, and the triglycerides are all within normal range, so I'm good to go. Now, I feel no symptoms having hypercholesteremia because there are none. Now, teaching about nutrition and cardiac rehab allowed me to show how poor diet affects your cholesterol levels. Too many people are on the run and they're eating fast food and drinking sodas. Raise your hand if you're a fast food junkie, okay? These foods are high in saturated fat and sugar, and in turn, they clog your arteries. So I carry a bag of almonds in my car, and I always drink lots of water. You have to remember the 8-8 rule. That's 8 ounces 8 times a day. So choosing to be healthy is a lifestyle, and it starts at a young age and it continues through life until we die. So let us talk about sustainable methods of treatment and prevention measures we can take to live a healthy lifestyle and to prevent obesity and heart disease. Now, the Harvard School of Public Health released an article stating that overweight people could cut heart disease by more than half. So clearly it shows monitoring your blood pressure, your cholesterol levels, and blood sugar. These are tools to manage obesity. So in the chat, put a yes or no if you do any of these. You know, be proactive and monitor your blood pressure. You can go to any Walgreens and have your blood pressure checked. I have a blood pressure cuff, which is also called a sphygmomanometer. That's a tongue twister. And I have it at home, and I monitor my husband Kevin's blood pressure. Now, the CDC states nearly half of all American adults attempt to lose weight each year. Healthon.com states the most effective way to lose weight is to eat proper diets, including a low carbohydrate and a low fat. So put a 1 in the chat if you ever went on some type of a fad diet. You know, really all you need to do is cut down on carbohydrates. So I try to avoid processed food, sugar, sodas, chips, breads, things like that. I eat healthy carbs such as sweet potatoes, blueberries, quinoa, and oats. I love oatmeal. You know, a low-fat diet, it helps weight loss, and it is heart healthy. I also enjoy salmon, avocados, nuts, and eggs. So these are all healthy, high-fat foods. And, you know, replacing regular oil with extra virgin oil, that does make a difference. So the Mayo Clinic, it states that size matters, okay? Research shows that bigger proportions contribute to bigger waistlines. So match up your portions to visual clues, such as a deck of cards for protein portions, okay? A baseball is for fruit and vegetables. Dice, that is for amount of fat, and a hockey puck, that is for your amount of carbohydrates. So, you know, eat slow, and just enjoy your meal. Your body will feel fuller and avoid second helpings. I eat off of a small plate rather than your regular large dinner plate, and therefore I'm controlling my portions. The Cleveland Clinic of Florida offers diagnostic testing such as blood tests, electrocardiograms, and stress tests to monitor baseline heart function. So electrocardiogram is also an EKG. This is a test that basically shows the electrical signals of your heart. So when my patients came into rehab, I would first put a 3-lead EKG on them, and then I would take their vital signs. So I would perform group exercises on the floor with them, and then they would hop on a treadmill or a bike, and while they were doing that, I would educate them on what a healthy diet is. And then the other days, I would sit at the desk and I would monitor their EKG. I was advanced cardiac life support certified, and so I was monitoring what their heart rhythm was doing. And sometimes they would have arrhythmias, okay, which is an abnormal heart rhythm. So I would stop their exercise, and if it was not life-threatening, then they would resume, and I would continue to monitor them closely. So there's a different couple types of stress tests used to evaluate your heart when you exercise. So basically, in a stress test, your blood pressure, your heart rate, and your EKG are being monitored. So the patient basically walks on a treadmill, and then the treadmill is elevated at different levels and then different speeds. So the doctor would read the stress test, and then after that, I would implement the correct exercise regimen for my patient. But then there's a nuclear stress test, okay? So these stress tests have a dye that's injected into the vein prior to the test, and it can detect when arteries have more than 70% blockage. Johns Hopkins recommends 7 heart benefits of exercise. Research shows exercise lowers blood pressure, weight control, strengthens muscles, can slow down the development of diabetes, it reduces stress levels, it reduces inflammation, and it can help you even stop smoking. So by a show of hands, who exercises? I love to exercise, and I work out just about 7 days a week. I bought a Peloton when COVID happened, and it's wonderful. It has everything on there: spinning, strength training, boot camps, yoga, meditation. It has it all. And my natural endorphins are flowing. It's a very healthy way to get high. Everyone say endorphins. So my father, Jerry, he instilled exercise in my life and in my 4 siblings since we were very young. And he's 86 years old, and he still works out. He goes to the gym, and he plays golf. I do my best to instill exercise and diet in my children, because my husband, he doesn't listen. WebMD.com offers exercises to get you up and moving. So find your niche. Do what you enjoy doing. I used to love running, but after my knee injury, I can't anymore, unfortunately. So I spin, and that is non-weight bearing. So that's really good on my arthritic knees. Walking and enjoying the outdoors is also a beautiful outlet. So make an effort also to incorporate weight training in your exercise regimen. So sometimes, besides the just regular, 10, 15, or 20 pound dumbbells, I use smaller weights with higher reps. So this increases metabolism. True or false in the chat? High metabolism burns fat. It's true. It is true. And body weight works just as good. You could do push-ups, pull-ups, planks, air squats. So now that we are heart healthy, let's wrap it up. Today I addressed heart disease and the preventative measures to decrease your risks. I increased your knowledge in particularly about hypertension and hyperlipidemia, and I provided you with sustainable measures to prevent heart disease. Remember, everybody, you are what you eat.